In today's Health Alert, the CDC is sounding the alarm about discrimination in women's health care, particularly for Black and Latino mothers.
Yeah, raising the alarm is especially important because maternal deaths continue to rise at alarming rates here in the U.S. AB's Chief Medical Correspondent Dr. Ashton is here today to talk much more about this. Tell us about this very important study, Jen.
Okay, you guys, this study is going to get a lot of attention for two reasons. Not only the findings, but also the methodology. Obviously, some controversy involved, but let's start with the findings. This was a survey done by the CDC looking at what's being called a non-representative sample of women 5 years after they've delivered. So it may not be able to be extrapolated to the entire U.S. population. But the findings, if this were a patient satisfaction report card, not good. Anywhere from 30 to 45% of moms, Black and multiracial in particular, felt they were under the perception that their voices were not heard, that they were unable to ask a question to their provider. In some cases, physical privacy issues were violated. So their perception, not good. In terms of the methodology, recall bias definitely at play. And again, this was based on their perception. So a medical investigation into the truth or accuracy of this perception and these claims was not undertaken. But we know that patient communication is critical for safety, and this is obviously something that needs to be improved upon. ACOG just came out with a statement saying they encourage all women to feel empowered to speak up, raise their concerns, and ask questions to their providers. And they've even gone so far as to say, and these are the potential medical emergency signs and symptoms you should know about as a patient, so you can bring that attention to your provider. But we all need to do better because the maternal mortality rate in this country is not good.
It's so great to bring up that topic and have that real conversation.
So important.
You know, and so much of that involves maternal care. And so it's something just interesting that's coming up right now. The FDA just approved a vaccine to protect newborns from RSV, and this one is given to the mothers before birth. So tell us about how that works.
So another hurdle cleared. The CDC still needs to sign off on this. No word yet on when they're going to be making that ruling, but we're thinking that this vaccine may be available for pregnant women to use late in the third trimester, hopefully in time for the RSV season this fall. But in clinical trials, when given to the mom, it was found to be more than 80% effective in reducing the risk of severe RSV in that infant, which we know is significant. Up to 80,000 children are hospitalized every year with RSV. 2 out of 3 infants infected will require hospitalization, so we'll be staying on top of this, too.
Yeah. All right, speaking of vaccines, start of the school year just around the corner happens to coincide with a significant increase in COVID that we're seeing. So talk us through what parents should be doing.
Well, listen, I know we're all tired of hearing about it, but the virus isn't going anywhere, so we need to pay attention to what's going on with COVID, not only in the country, but here in the tri-state area. Yes, the cases are up. Vaccination and boosting still the best weapon in our toolbox. We know how to modify our own behavior if we need to. You know, hand hygiene, stay home if you're sick, testing, ventilation, all of those things come back to our memory. But again, this is going to be something we're going to have to keep an eye on. And when that new vaccine comes out this fall and the flu vaccine comes out, every doctor is going to be recommending that patients, including kids, get revaccinated or boosted.
And it's been a while since we've all been boosted.
Yes, it has been.
You know?
And we, spend our time checking in with Chief Medical Correspondent Jen Ashton. I feel like Chief, I should give you a salute.
No,
you know,
not
every time I introduce you.
Very informal.
Thank you, Chief.
Very informal.
Always the best. Really appreciate it.
Thank you,
Jen.